Hello, everyone. Welcome to the Dr. Sophia ObGyn Podcast. I'm an ObGyn practicing for over 15 years in my native New York City, and I love to help women learn about their bodies, empower them, and embrace themselves. On this podcast, we talk openly and with heart about all things affecting women, from pregnancy, menopause, periods, sexual health, fertility, and so much more. Disclaimer: this is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Hello, everyone, and welcome to the Dr. Sophia ObGyn Podcast. Today, and I know I'm always super excited for every episode, but I'm so excited about this episode. We're going to be talking about vaginal lacerations during childbirth. And the reason why I'm so excited about it is because no one ever talks about it. And the fact that it is such a common thing that happens at delivery and that women go through on an every single day basis. And as always, it all started from a conversation that Touseef and I were having. And so without further ado, I am joined by my good friend and co-host, Touseef Mirza.
Hello, everybody. So just to be clear, when we say lacerations, we mean tears.
Tears, cuts,
abrasions.
Mm-hmm.
So one of the things we started to talk about was different aspects of pregnancy. And we talked about, what are different things that we could bring to all of you that's not talked about a lot. And then I remember this was a long time ago, time flies, but it was with Cardi B. And Cardi B, when she had her first baby, which was in 2018, she just went on talk show hosts. And usually people say, oh, how was your pregnancy? How's it going? And everybody's like, oh, it was an amazing experience and it was beautiful. And Cardi B, being the badass that she is, said those things as well. And then she said, I didn't realize that the baby was going to break my vagina. Just dropped it right there.
Mic drop.
And I think that is so interesting to me that it's something that happens all the time. We never talk about it. And then Cardi B opens, it's like a little bit like what menopause has happened, right? Nobody used to talk about it. Now we've opened that aperture and now everybody's talking about it. I don't think we're there yet with the vaginal tears, but we should.
We absolutely should, because vaginal tears happens in about 80% of vaginal deliveries.
Which is so wild that it's so much. When we were doing the research, I had no idea that it was 80%. I thought it was maybe, 30, 40%, but it's almost the norm.
It happens. And when we say vaginal tears, we're talking about the entire gamut, right? So whether we're talking about just a small cut, an abrasion, a deeper laceration, or deeper cut, and in medical terms, we have varying degrees of how severe, from least severe being a first degree tear to a more severe, or the most severe tear being a fourth degree tear or laceration.
So let's start from the beginning. So when a woman is in labor,
yes,
is the vagina already starting to be a little bit different? So basically this episode is about everything that happens to the vagina and the vulva during delivery, and certain effects that can happen as well. So during just labor, are we already seeing certain changes in the vagina?
Absolutely. The changes of the vagina start from the pregnancy itself. The hormonal changes that happen in the body because of pregnancy have a big influence on the vagina and the cervix and the vulva. And so one major thing is that there's a dramatic increase in estrogen, for example. Estrogen is going to help the vagina become a lot more full of blood and just more vascular. And so it also kind of, because of that, beefs up the tissue. The vaginal tissue becomes thicker, more elastic.
So you're saying vascular, meaning there's more blood vessels okay, that appear in order to accommodate what's going to happen.
That is correct. And those increase in blood vessels is also adding more nutrients to the vagina and therefore increasing the thickness and elasticity of the vaginal tissue to help it become more elastic.
When do these changes actually happen when you're pregnant? Does it happen like closer to when you're about to deliver, or?
The changes start from the beginning of the pregnancy. You already have a surge that's happening in terms of estrogen, both estrogen and progesterone. So progesterone is having a relaxing effect on ligaments and other tissues in order to just accommodate the baby that's going to be coming through. The vagina also becomes a lot more moist. So there's a lot more discharge that's happening at the level of the vagina. And all of that is happening throughout the pregnancy.
So when you say discharge, you're basically seeing different spots coming out on your underwear throughout your pregnancy.
Yes. So we love to talk about discharge, of course, on this podcast. But the thing is the understanding that you'll have a little bit more typically when you're pregnant.
And it doesn't mean that you're dirty. It doesn't mean that something's wrong. This is just the vagina preparing itself.
That is correct. No, there's definitely nothing wrong. Certainly, of course, if it's not smelly or itchy or causing you any kind of discomfort. But yes, this is the normal stuff. And so when we actually get to the delivery process, I just think the vagina is such an amazing organ. The concept of the fact that a baby can pass through the vagina, which has an opening that's not more than typically 3 or 4 centimeters. And then a baby's head that's fully 10 centimeters typically has to pass through. Granted, the vagina obviously also accommodates for sexual intercourse, but it's still not 10 centimeters.
So just to back up for those of you that just to make sure we understand all the anatomically aspects of the vagina and the vulva, can you just explain where is exactly the vagina, the vulva, and the cervix? Because we're going to be talking about those.
The cervix is the lowest most part of the womb, and it is at the apex or inside, deep inside of the vagina.
So at the bottom of the uterus.
At the bottom of the uterus, at the top of the vagina on the inside is where your cervix is located. The cervix has to open completely in order to allow for passage of the baby. The vagina is the tunnel or the tube that the baby has to travel down in order to get out and be delivered and be birthed. The vulva includes the labia or the lips of the vagina. It includes the clitoris. It includes the perineum, the connection between the vagina and the anal region, that part of the pelvic floor that connects where the vagina ends and where the anus then will begin.
So the vulva is mostly the exterior part.
That is correct.
Okay. So when we're getting close to delivery and the mom-to-be is in labor, I know we talked about that the vagina has already thickened and is now vascular. Are there certain changes even happening just moments before the baby comes out? Or it's just getting ready to become more stretchy?
It really is just becoming more stretchy, as you say. The vagina will have a lot more pressure on top of it just because of the fact that the baby is now coming down. It will have a lot more pressure. So those blood vessels are going to be even more thickened or more pronounced is what I should say. Some women, even during their pregnancy, can experience, because of the weight of the pregnancy and the pressure on the blood vessels that are at the level of the vagina and vulva, at the level of the vulva, they may even experience things such as varicose veins, something that we usually think of happening on our legs or, like spider veins or varicose veins that we think of that can happen at the level of at the legs, but can actually be happening even on the vulva just because of that increased pressure.
So then labor starts, the baby starts to make its way into the vagina.
The vaginal canal.
The vaginal canal. So can you just talk us through, like, as you being the OBGYN and welcoming, how do you say,
I like to usher.
Usher, exactly. I love that term. As you are ushering the baby into this world, can you tell us a little bit about like what are you seeing or how is the baby coming out and how is the vaginal canal changing or the vulva and how do you just approach all of these elements?
So, vaginal birth is still my favorite part of what I do. And it's different for everyone and it changes even for me. However, some things definitely stay the same. You get excited as you start to see the top of the baby's head kind of poking through with every contraction and every push as the baby's head is slowly making its way for allowing for the opening of the vagina. And it opens ever so slight, and then a little bit more, and then a little bit more, and a little bit more as the mom has her contractions and pushing efforts when we're at that point. Now, in order to get to pushing, let's just go back a step because your cervix has to open fully to 10 centimeters, what we call fully dilated. And the head of the baby has to become low enough so that way the mom's pushing actually has effective change, like the baby's actually moving down the vaginal canal. And we want that to happen in a very kind of a rhythmic kind of a way, is the best way for me to put it.
And is the reason for that is because if it's coming in a rhythmic way, like you're saying, then the vagina has more time to slowly open?
The vagina then has time to accommodate for that baby's head that's coming down. Because what we hopefully can try to, I don't want to say avoid, because women, listen, we have been having babies for centuries, right? For years, for millennia, right? We've been delivering our own babies. And the majority of the time has actually been not in a hospital, not in a medicated place, in this very sterile kind of environment, right? We've been doing it in villages, we've been doing it in homes. So I don't want to take anything away from what the body is naturally fit for. But me, as the OBGYN who is happy to usher in the baby, I would like to see that the baby is coming in down in this rhythmic kind of way, because then it kind of gives, like I said, the opportunity for the vagina to accommodate, for that head to come down slowly, for those tissues to kind of become accustomed to what's happening at that moment in order to hopefully prevent big tears.
But if she does start to push too much, if she can't help it and she goes, oh my God, I can't help it. It has to just come out. I can't, and it's just coming out. Do you try to slow her down in that situation? What do you do?
I would say that vaginal birth is so many different ways in which women give birth. And so sometimes they're medicated in the sense that they can have like an epidural, for example, or they can have other IV medications that can make them a lot more relaxed, perhaps during the birth. And at other times can make them not even feel the pressure or the pain of going through the birth. So we have to take into account the two different situations. One that is an unmedicated birth, meaning no pain medication, no medications that are going to help take away the pain aspect, versus a medicated birth, for which in both scenarios, you can still have lacerations, you can still have vaginal tears. But certainly in a woman who has no pain medication on board, you want to have as much control in how she's pushing and helping her to manage her pain so that you don't have the explosive forces that women really have. Like women are we are strong. We are like Mack truck tons strong. Okay. And when we're pushing, all of that strength comes out. And so we can have vaginal tears that happen just due to shearing, what we call shearing forces. So it's like the head coming out with so much force and so quick that the vagina doesn't have an opportunity to accommodate. And so it shears or tears right straight down the actual vagina tissues.
I didn't realize that the vaginal tears are as prominent as the vulva tears. In my mind, that there would be a lot of tears around the vulva because everything, it's true, the whole baby is coming through the vaginal canal and eventually through the vulva. But in my mind, I just didn't know if the vulva would be that elastic. So I always thought vulva would be more tears. But
You mean like the labia, you mean?
yeah, around the
labia.
or the lips, like
Yeah.
when the baby is actually coming out. So I thought, probably that area is not very stretchy. And so that's where the main tears would be. But as you're talking, there's a lot of that actually happens in the vaginal canal.
Sometimes even before the head even comes out, the woman can experience tears that are happening inside of the vagina as the baby is coming down the vaginal canal. Those tears are called sulcal tears that can happen along with the different varying degrees of the tears, as we talked about. And the degrees of the tears matters because something called a first degree tear is only going to be a tear that's through the vaginal skin and through the vaginal mucosa. Something called a fourth degree tear, which is usually is considered the most severe type, is going to tear through the vagina, the tissue of the vagina. It's going to tear through the muscles or the pelvic floor muscles or perineal muscles. It's going to tear through all of those muscles. It's going to tear through what we call the anal sphincter or around the anus, and then tear through the anus and even through the rectum. So you have multiple layers that can have tears. And so the varying degrees is the varying degrees of how deep, how much layers of tissue have we gone through. And the most common, I would say, are the first degree and the second degree tears, which incorporate the skin of the vagina, the mucosa or the tissue of the vagina, and sometimes partially a little bit of the muscle tissue of the vagina or what we call the perineal body or the perineal muscles.
Which is at the bottom?
Which is at the bottom, yes.
Okay.
The bottom part of the vagina.
Okay. So then when the baby is coming out in the vaginal canal, what can you do as an OBGYN to try to maybe not prevent the tear, but at least, try to prevent the tear first, or at least reduce the potential intensity of the tear?
So I want women to have the birth that they want, whether that is an unmedicated birth or a medicated birth. And what I will say is that women who have a medicated birth can have a little bit more control if they are able to have their pain better controlled. I think women who have unmedicated birth can have the same amount of control, but may take a lot more coaching, or they may do a lot more prep, mental prep, emotional prep, before they get to the actual pushing part. And for a lot of women, it's not even the pushing part that's so dramatic as much as the contractions, which are so painful. When they actually get the opportunity to be at the level of pushing, that's actually when they feel a lot more relief because you're pushing against that pressure. And it feels so much more, you can actually get a sense of relief. Now, granted, nothing takes away what's called the ring of fire. The ring of fire, when the baby's head is there and it's that maximal stretch that's happening at the introitus or the opening of the vagina, what we call crowning, when that baby's head is almost halfway out. And that ring of fire, whew, I remember.
It was like fire.
It feels like fire. You feel like you're trying to deliver a hot brick. Like, I have no other way of describing it at times other than to say that it feels like you're trying to deliver a hot brick. It's a very intense feeling, and that's with or without medication. So without medication, you can just imagine you can like double and triple that feeling. And so it takes coaching.
So can you give us an example? I remember you were telling me once with one of your patients, how you were helping that control back and forth. And when I asked you, could you talk about it on the podcast? You're just like, I do that all the time. So can you just share with us that part?
So when I say coaching, you want the mom to push effectively But when we're at that end, that last phase, the head is coming out. I want her to give her all she has. I want her to give me all she has, but at the same time, to really be listening. So that way, when I say, okay, give me a soft push, give me a little baby push, because I'm trying to get the head to come out as slowly as possible. Okay. And I'm giving what we call counter pressure. And I have to give a shout out to someone named TP. TP, you know who you are, because she taught me the art of balance and control and counter pressure.
So when you say counter pressure, you're saying basically you're asking the woman to push, but if she's pushing too much, you yourself with your hand and your arm have to push against the baby.
That is correct.
So that it doesn't come out too fast. And if it comes out too fast, then
what happens when the baby comes out kind of with this big explosive force, then that's when you can have major tears, the more severe tears and lacerations. There is something called an episiotomy, which is a cut that the provider, the obstetrician, the midwife, the provider, the person who's delivering the baby can cut the vagina if they see that the vagina is going to tear in order to accommodate or make space. However, there's enough evidence to show that it's better for a woman to have her own natural tear than to cut the episiotomy. And the reason why is because once you've started to make the cut, that if the tear is going to be a bad tear, it ends up being worse when there is an episiotomy cut. And so for me in my practice, I can count on one hand how many times I've cut an episiotomy.
All right, let's go back to the counterpart pressure. So you're there and you're pushing the head of the baby back, and just like, it's almost like going back and forth a little bit. It's like rocking. Literally, it's a rocking.
And let me tell you, like I said, women have Mack truck energy and strength when it comes to pushing out a baby. So imagine that I have to now be trying to put my little, I'm not that little, but regardless, my size, pushing against this woman who's pushing like, basically her life depends on it.
Right. So you're getting a workout.
I am getting I get a workout with every delivery. Yes, that is very true. I have to maintain my upper body strength. I do my push-ups every day, and those push-ups are to be able to deliver babies.
And that whole point is because you're trying to save that woman's vagina.
100%. I am trying to save the vagina from having an explosive delivery and an exploded vagina.
So when you say explosive delivery, does that mean basically that the baby's coming out too fast?
Yes.
Okay. And explosive vagina? What does that mean?
In my head?
Yeah.
That everything tears.
Okay. All right.
Everything tears. The lips tear, the vagina tears, the muscle tears, the perennial tears all the way through to the anus. I mean, this is what I'm trying to prevent the whole time.
And then you were telling me that you also had a personal experience with your firstborn.
That is correct. When I had my first child, I had what's called a 3rd-degree laceration, which is one of the more severe ones. And I think it's because, literally at that time, we're talking like 25 years ago.
This is even before you were an OBGYN.
This is way before I was a girl. I cannot say that I would have children right now if I had been an OBGYN before I had kids. Although I did really want to be a mom. So I don't know, the school's out on that one. But yeah, it was way before I had any idea or clue of what is happening to my body.
Did you even have knowledge that this might happen?
No, I had no idea. I had no idea what was going to happen to my vagina. I had no idea.
Nobody said you might have some abrasions or tears?
No. No, I did not get any of that education. I did not get any of that. By the way, listeners, it happens, whether it's a little abrasion or a big tear, okay? Let's say this again, 80% of vaginal deliveries have the potential to have a tear, okay? And especially with the firstborn.
And what's crazy, if there's that many, why aren't women
talking about it?
Why women don't know about this to be mentally
I
prepared.
was not prepared. Let me tell you again, my own personal experience. I was fully unprepared for the fact that I had something called a third degree tear. And
What does that mean?
it means that it went through the vaginal tissue, the skin, the mucosa, and through the muscles of the perineal body, or the perineum, the transverse perineal tissue.
Girl.
Muscle was totally torn and had to be repaired in layers. And no, I had no idea. And let me tell you, back then, we don't do this anymore, okay? But back then, the nurse was giving me what we call fundal pressure. Fundal pressure means literally applying pressure at the top of the uterus, because I was so exhausted when it was, pushing. I was exhausted and just felt like I couldn't push anymore. And I felt like my baby was so big. Like, how is this baby coming out? It's not happening. And I guess perhaps his heart rate was going down, or something was happening that he needed to come out, like right then and there.
Mm-hmm.
Okay. And literally the nurse went on my belly with her knee.
To try to push it out.
To push him out. I'm not kidding.
Wow. And obviously your vagina wasn't ready for that.
And so my son came out like, whoosh, like there was, but he had to come out. I get it.
Right.
And thank God we don't do this anymore.
Right.
This is not how we affect vaginal births anymore, with fundal pressure. But yeah, he came out, and yes, I had what I consider as the exploded vagina. Okay. But there's more to it, because afterwards, after the repair, there's the recovery. There is how do you deal with your bottom feeling swollen, irritated, pain, just pain. I just remember pain. So now you've done all this work to have a baby, and then there's more pain. So this is the part of the vaginal delivery part that I feel like we just don't talk about, and women need to know it's a possibility, and it depends. It matters how we are pushing. It matters the relationship you're having with the provider that is pushing with you, that's helping you to usher in this baby, because how aggressive we need to be at the time of birth, and how that can impact the way the vagina accommodates or does not accommodate for that baby.
That sounds so super scary. I've never had a child. Don't regret that. So let me ask you, when we say a vaginal tear, when we say a tear at the level of the vulva, like what is it actually, and how do you actually repair it?
So the repair requires stitches, and you repair it in layers. So every layer that has torn has to be brought back together in its own space.
So let's say you have a vaginal tear, like once the baby comes out, you're going in the vagina to check, is everything okay?
Yes.
Okay. So, and then you see, there's a tear, there's a laceration.
And let's be clear, after a woman has had a baby, so she's already gone through all of the pain and of the contractions, and now she has to go through that ring of fire of pushing that baby out. Her vagina becomes even more sensitive, right? She's already had to go through vaginal exams in order to see how dilated she is. The baby has to come out, etc. After the baby comes out, it's as if your vagina is on 10. And now I have to say, okay, I have to do your repair. And when you have to do the repair, especially in a mother who has been unmedicated, every single touch, just to dab a little bit to stop bleeding is like you're hitting her with a hammer. And so we as providers have to remember that, right? As providers, we have to remember, yes, I know she just pushed out this 8.5-pound baby, but her vagina feels on fire. And how do we accommodate cooling it down? How do we accommodate her to help her go through the repair?
And does it have to happen right after delivery?
It does, because a laceration or a cut or a tear, remember the vagina we talked about has all these blood vessels. And so you can bleed, and you can bleed to death.
If it's a
big tear,
deep tear.
it's a big deep tear that we are not able to see or we are not able to repair in a very timely fashion. Like this, there's a lot of blood loss that can happen right there, just from your tear.
So it has to happen right then and there?
Yes.
And do you give
Numbing.
Local anesthesia?
Yes.
Okay.
We give local anesthesia.
Thank God.
Thank goodness. But again, like I said, the entire vagina becomes so uncomfortable. Painful even. I don't want to even use the term uncomfortable because it's more than that, you know? And so to give the local numbing medication can be painful, you know? So it's important to wait to see that it actually is working, to test, to make sure that the woman isn't going to feel the sharp of the needles and the suture that you have to use in order to actually repair the vagina. And so there's a lot that goes to it. And that can happen whether the woman is medicated or not. Even if she has an epidural and it's a good functioning epidural, you have at least that on your side, that she may not feel sharp. She may not feel all of the pain and the burning sensation that can happen. And so to that end, having adequate pain medication on board at the time of delivery can be very helpful in a woman who has a laceration, for sure. And outside of that, once the repair happens, is to really give the woman true, expectations. Use the cold ice packs. Use the Tux pads. Use the numbing agents or ointments or whatever they can bring you in order to help the vagina feel a little bit better. Use what's called a peri bottle. It's like a little squeezy bottle that you fill with water every time you go to use the bathroom. Just imagine the agony.
You mean versus wiping yourself?
Versus wiping yourself. The agony of having to just to pee after you've had a baby. How excruciating that can be.
If you have tears, it's
if
burned.
You have tears. And even when you don't have tears, because just the head passing through, remember, when the head is passing through the vagina, it is pressing up against everything. It presses up against your bladder. It presses up against your urethra. It presses up against all the walls of the vagina, that head coming through. And so the first few times that you have to go to void, to pee, can feel like painful, burning, discomfort, you know? So we're always happy for the women who are able to go through childbirth without any of this. But a lot of women go through childbirth experiencing some form of this. And this is just to give real world expectations. Now, women, we are strong. We are strong. We can do anything. We can have babies. We can get through and live through our vaginal deliveries and vaginal tears. And the vagina is so forgiving. It's such a forgiving place. It's such an amazing organ in that when repaired, when I see that woman again at 6 weeks, it looks like nothing happened because of all of those blood vessels, because of how that tissue comes back together and heals nicely as if nothing happened. You know, now granted, she's not feeling that way, but
her vagina is doing it.
Her vagina is doing a thing when it's repairing and going back to what it once was before she had a baby. You know, I do want to mention the fact that and we'll have to do a whole nother podcast on this, but after delivery, the importance of women doing things like pelvic floor exercises, things that help the vagina to regain its muscle strength and elasticity, with the way in which they do these exercises that help with the pelvic floor. And I wish we did much more of this in this country, which is pelvic floor therapy after vaginal delivery, something that is, a part of routine care in other countries, but unfortunately it's not here. but the importance of doing that in order to help a woman feel much more like herself when she's ready to go back into her sexual life, for example. Again, a whole nother podcast
Yes,
of sex after delivery. But here, the conversation was to be about vaginal lacerations and tears.
So, as we talked about, this is a much common thing that happens than most people realize. So what can women do? What are certain tips that women can do if they know they're going to be delivering this child? Like, are there anything that they can do to prepare themselves or to ease the pain?
I would say that women need to, if they can, really become as active as they can during pregnancy. Stay active. Do squats. Do the things that are going to just help you be as strong as possible, have as much control as possible. What does that mean? Like, figure out what are going to be the things that help you through painful situations. If that means for you getting an epidural, by all means, get the epidural. If you are someone who's like, I can do this without medication, that's okay. But then really commit to how you're going to do this without medication, whether that means diverting that pain center like to something else. Like I've had patients who've had these metal combs that they squeeze every time they get a contraction, or that they were able to squeeze and hold on to when they had to actually do the pushing. And that helped them to divert the concept of where the pain was happening. And it helped them to have a lot more control, whether it's your breathing exercises, whether it's who you have with you in the room, having a doula, having someone, a support person with you who can help with calming you down, keeping you in a state of Zen, even if that's possible, when you're delivering, having aromatherapy, having the music playing that you want in the room when your baby's coming out, all of these things, asking for a warm towel even while you're pushing your baby.
And also just the recognition and awareness and realizing that this is something that might happen so that you're mentally prepared.
Oh, 100%. 100%. Being mentally prepared is, I think, 80% of the battle. Knowing that there's a possibility that it can happen, having a conversation with your provider, understanding what are their methods to try to mitigate tears so that they don't happen, or that if they do, that they're not the worst type. Like, know your doctor's statistics. Me personally, I have not had a 4th-degree laceration in years. When I say years, over 5, 6, 7 years. And even a 3rd-degree laceration I haven't had in years.
So can somebody literally say to their provider, can we try everything to have minimal or no tears? Can somebody literally ask that to their provider?
Yes, and I think probably the number one thing they should ask is whether or not their provider routinely cuts something called an episiotomy.
Okay, because that's not ideal to do that.
Well, because it can lead to a lot of, post-delivery vaginal pain.
I'm so glad we did this episode. Like, this knowledge should be known by everyone. All pregnant women, all non-pregnant women, all men, like everybody, to really understand the full journey that women go through. And by the way, the journey that we all went through when we were going through the vaginal canal. Like, this is such good information. So thank you for just being so open and sharing all your experiences through it too.
I mean, I'm just so thankful that women allow me to be a part of that experience for them. It is an experience that still brings me a lot of joy, is vaginal delivery. And I think this is valid information that a woman should talk about, understand, know, so that she can, as we said, mentally prepare. And this all goes back to our motto: embrace your body, know your own abilities, have a clear conversation so that you can best embrace yourself. Until next time, thank you so much for listening to the Dr. Sophia ObGyn Podcast. See you later.
Bye.
Bye. This is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Until next time, embrace your body, embrace yourself.